This is Daniel Allen.
And this is Joe Thomas.
And you're tuned into episode 19 of The Dan Show.
The closing of WellStar Atlanta Medical Center.
On October 14th, 2022, WellStar Atlanta Medical Center closed its emergency room. On November 1st, 2022, the Level 1 Trauma Center, with 460 beds and about 700 physicians, closed entirely, ending all operations and services after almost a century. With the front entrance on Parkway Drive and the entrance to the emergency room on Boulevard, the hospital formerly known as Georgia Baptist has been a staple in the old Fourth Ward, Atlanta, Georgia, for 96 years. The literal trials and tribulation it has faced over its years of service appear to be the cause of the situation it now faces, but doesn't seem reflective of the surrounding community. A neighborhood that once housed some of the city's most impoverished residents and brick apartment homes is now the home to luxury apartments, condos, and townhomes, and transplant owners. While there is apparently plenty of resources to quote-unquote redevelop this community, it does not appear that the health of those residents is a priority for the time being. In this episode, Joe and I plan to explore the historical background of Atlanta Medical Center and Fourth Ward, the problems they faced and the direction, or lack thereof, that they are headed.
The pastor at Tabernacle Baptist Church, Dr. Leonard Gaston Broughton, opened the Tabernacle Baptist Infirmary on Thanksgiving Day 1901. Operating out of a rented house in downtown Atlanta, it only had 5 beds and himself as the only physician. This son of an officer of the 26th North Carolina Regiment in the Confederate Army grew his whites-only hospital to 75 beds and a full staff within 9 years. In 1913, the Georgia Baptist Convention purchased the infirmary for $85,000, and the Reverend James Long managed the hospital to self-sufficiency by 1916 under the new name Georgia Baptist Hospital.
The Georgia Baptist Convention purchased the land in 1926, where former Councilman Levi B. Nelson's mansion once burned to the ground. In 1934, Georgia's first cancer clinic was constructed on this campus. It housed about 250 doctors and 188 staff to support it.
In 1948, a building program was undertaken to expand the hospital, and by 1956, the office space for medical professionals was added.
The hospital underwent construction in 1948, so by 1956 there were offices opened for medical professionals. Georgia Baptist started the state's first and the country's third cardiac rehabilitation program in 1970, and started Atlanta's first coronary care unit in the hospital's north tower.
523 patient beds and 43 infant beds were included in the 10-story patient tower completed by 1974. An air ambulance service was initiated via heliport in 1981. Then it was purchased by Tenet Healthcare in September 1997 and renamed Atlanta Medical Center. A for-profit multinational healthcare services company based in Dallas, Texas, Tenet Healthcare Corporation operates 65 hospitals and 450 healthcare facilities. They also have a reputation for fraud, bribery, unnecessary heart surgeries, and tax dodging and lobbying.
In March 2016, Tenet sold AMC to WellStar. By the time it closed, the Level 1 Trauma Center had 700 doctors and 460 beds.
On October 3rd, 2016, the Department of Justice's U.S. Attorney's Office for the Northern District of Georgia released a statement that Tenet Healthcare will pay more than $513 million for defrauding the United States and making illegal payment in exchange for patient referrals. In this case, Tenet subsidiaries Atlanta Medical Center, Inc. and North Fulton Medical Center, Inc. pleaded guilty to conspiracy to defraud the U.S. and pay healthcare kickbacks and bribes in violation of the anti-kickback statute, and were ordered to pay $145 million. U.S. Attorney John Horn stated, Tenet cheated the Medicaid system by paying bribes and kickbacks to a prenatal clinic to unlawfully refer over 20,000 medical patients to the hospitals. In doing so, they exploited some of the most vulnerable members of our community and took advantage of a payment system designed to ensure that underprivileged patients have choices in receiving care. The hospital housed a neurointensive care unit and a level 3 neonatal ICU.
Fourth Ward is one of the first communities hit the most by gentrification. Behind me is the apartments I grew up in. The neighborhood barely looks the same. Right next door to the apartments I grew up in stands homes that look like this one. Until the early 2000s, there had always been a clear distinction between Fourth Ward and Midtown. With the rebranding of the Murder Kroger, the birth of the Beltline, and City Hall East upgrade to Ponce City Market, the lines have become more blurred as to where one ends and the other begins. I wrote a post at the beginning of 2019 about my observations of the ramping up of gentrification in the city and about what the Beltline had become compared to what the residents thought they were getting. The post reads like this. Residents of Atlanta are slowly but surely being forced out of the city for developments and high prices not designed to revitalize communities, but to make them disappear completely. Gentrification is a real thing happening in this city, and having lived here my whole life, it's sickening to see this blatantly happening. People were excited about the Beltline. Now it's here, and people won't be able to remain in the communities they've known as home. What was the point of the Beltline? I thought it was to connect and bring the city together. I guess they were referring to the new finished product of what the city will ultimately become. Major developments that look good on paper, but in reality, not good for the community. In fact, there is no care at all for the community, only securing the land. We slapped a $1.5 billion stadium in the middle of the most rundown area in the city. Has Mercedes-Benz Stadium been a help to its surrounding community? This new reservoir park going up in Vine City will have the same effects of pretending to build up an area when in reality you're just driving everyone out. Now, while I'm not against the development and advancement of certain areas, I just wonder how much actual concern there are for the communities involved. When I have these conversations with people who have money or in a position to live wherever they want, all I hear is, quote, people have to be able to pull their own weight, and quote, how long are we supposed to wait for communities to get better? The quote, old Atlanta we once knew and whatever culture you were once used to in this city will all be a myth very soon. Again, this was a post from January 2nd, 2019. Look where we've come today.
What should be the plan? What do you think should be the plan for residents who can't afford to live in the areas they've always lived in?
There's no plan. There's no plan. You're not going to be able. The history of urban areas shows that transition is a part of it. No area wants to be stagnant. People want to do better. They want their homes to be better. They want the streets to be better. They want everything that they buy to increase in value, not decrease. And if people were living in areas that were right at the poverty line, or just working class poor, as we call them, and the people who own that property where they live, they just don't have an obligation not to get richer. There's no moral obligation for them to say, well, I don't know where they're going to go. My property, I can sell it for $1 million, but I'm going to let them keep living there because I feel for them and they need to keep paying, $400 a month rent. That's not realistic. You're not going to be able to stay. Working class people, poor people, going to always take a hit in so-called democracies. But you can fight back. You can feel good about it, and you can win. But you, in my opinion, it's more than lip service. You got to find people really organized without trying to be on TV or trying to benefit from the person.
The Fourth Ward neighborhood still consists of a lot of its original community members. But like most of Atlanta, its culture is slowly being erased. The park behind me is where many members of the communities, whether adults or kids, spent time either having cookouts, having get-togethers, or learning how to shoot their first three-pointer. The park no longer has its basketball courts.
Ruth Glass described the transformation of working class London neighborhoods into middle and upper class neighborhoods in the 60s as gentrification. Today, it's used to describe the economic and cultural transition that occurs when wealthier residents start to move into predominantly lower income urban neighborhoods. This prompts cultural shifts, increases the price of homes and amenities, and the eventual displacement of long-standing lower income residents. Urban policy analyst Peter Dreer describes gentrification as just one symptom of a greater problem, a political and economic environment in which well-paid workers spend over half their salaries on rent, allows almost 2/3 of our country's workers to be paid unlivable wages, and does not guarantee or even actively promote access to necessities like healthcare or quality education, and a problem that can only be manifested where vast wealth inequality already exists. When Atlanta experienced its white flight in the early 20th century, upper and middle class neighborhoods in Atlanta experienced a decline, and when a neighborhood opposition to block 2 freeways through the southeast area of the city, communities like Inman Park, Grant Park, and Peoplestown were the first to be gentrified in the 1970s. By the 80s, Fourth Ward saw the precursors of gentrification that continued at a rapid pace during the first decades of the 2000s. Something of a colonization of Fourth Ward by Midtown, new units with ground floor retail along Ponce de Leon, North Avenue, Highland Avenue, and the newly installed Beltline were erected. Fourth Ward became the most sought-after area of the city by 2010, when it won Creative Loafing's award for Best Bet for Next Hot Hood. The area west of Boulevard went from 12% white to 30%, and the area east of Boulevard went from 2% to 20%. According to the Federal Reserve Bank of Philadelphia, Atlanta has the 4th largest share of neighborhoods being gentrified behind Washington, D.C., Portland, and Seattle.
The development at 495 Parkway Drive used to stand home to the leasing office for the Bedford Pine Apartments, the apartments that house most of the community of Fourth Ward. Behind me stands the Bedford Pines new leasing office. It's practically a trailer. In 1996, the Olympics put Atlanta on the world stage map, and they never stopped building since. Historically, Atlanta has been known as the city in the South where you could take advantage of the lifestyle and opportunities a thriving city has to offer without breaking the bank. It's also known for being one of the best cities in America for young black people to establish themselves professionally and financially before making their next moves. A shift began in the 2010s as a lot of the suburban residents of Metro Atlanta began to make their way back into the inner city. By 2018, Atlanta's housing market began to grow and the values of homes in the inner city neighborhoods began to increase. Many companies began to make Atlanta its new home, and with that, bringing a transplant of residents from all over the country, particularly from higher market areas. But even with this growth, Atlanta was still somewhat a secret in terms of being an affordable place to build a professional, economical, and family base. Atlanta would see the tail end of this once 2020 and the pandemic hit. Many cities were on strict lockdown, and working remotely became more prevalent. Once the pandemic was established as not a temporary thing, and states had decided how strict or not they were going to be with COVID restrictions, Georgia, Texas, and Florida became the 3 hot spots for people to visit and ultimately move to during the pandemic. The secret was out for Atlanta, and the housing market began to soar during the second half of 2020. By mid-2021, the cost of buying a home in Atlanta had almost doubled, and tech companies and their transplanted employees continued to push the market up. By March 2022, Atlanta had seen its peak in the housing market, and as we speak, Atlanta is no longer the affordable city to acquire a home nor to rent in. Other variables that drove up Atlanta's housing market was the subsequent bait and switch of the Beltline's supposed purpose, which was to connect prior non-connected parts of the city together via the paving over of old railroads and build, quote, affordable living along the development. To this day, there is nowhere that is connected to the Beltline that would be considered affordable, and the reality is that people are in fact being pushed out of their neighborhoods the more the Beltline is developed. Airbnb also causes problems for the community because the people who buy these inner city properties are usually not residents of Atlanta. They see it as an easy cash grab to rent out a place for tourists. Meanwhile, these homes are not available for the residents of the communities they live in, and the redevelopment of these units ultimately causes rental prices to increase. Atlanta has since limited the amount of Airbnb properties a person can own and set other stipulations, but the damage had already been done. Communities and its residents have been uprooted and are now occupied by people who either no longer can afford to live in the suburbs they grew up in or see Atlanta as a bargain compared to the historically high market city they come from: New York, Chicago, California, Boston, etc. Just like the closing of Atlanta Medical Center, Atlanta officials and city government are trying to pick up the pieces once it's too late. The damage is done. The hospital is closed. Gentrification is here to stay. Rent is through the roof. The Beltline is established. And neighborhoods, as well as its residents that once represented Atlanta's culture, are now being erased. But don't worry. Right down the street from the now closed hospital are condo units starting in the high 400,000s. Contact your realtor today. Fourth Ward historically has been known as one of the lowest income neighborhoods in the inner city. It is now the home for places like this, starting from the high 400,000s. Who's living in these places? Directly to the left of the unit starting from the high 400,000s stands this unit behind me. I have no idea what the development behind me is, but what I do know, it's not being constructed for the residents of Fourth Ward. Directly across the street from said development stands this unit. And directly to the left of the last unit I showed you stands this home.
In 2019, Mayor Keisha Lance Bottoms introduced a plan to create 20,000 affordable homes by 2026 and bring $1 billion in affordable housing investments. The looming pandemic and riots put a halt to these plans and brings into focus the $500,000 condos lining Boulevard, Parkway, and Angier, the streets where generations of my loved ones grew up dating back to the 50s, but where now none can afford to purchase a home. One might ask, with no end to gentrification in Fourth Ward in sight, what are the city's plans for the now closed hospital? Well, what do you think they should do with the hospital when they close it? What do you...
Well, there are a number of options, but within a year, that building's going to be raised. That whole area is going to be torn down, and you will have something along the lines of housing and entertainment and food complex there. It's an area that's just bursting with gentrification.
When's the last time you've been down there?
I go all the time. I live in the city. I drive. I just drove by there before we had this interview.
It's crazy, isn't it?
It's different. It's a vision that they have that kind of worries me because it's a way to make your city cleaner, make it more efficient when you talk about gentrification, using communities that are so abused because of trauma, drugs. People have left it, and so they get those areas and they turn them into something useful. But a lot of times it becomes unaffordable. Of course, the poor people live there can't afford it, but working class people can't afford it. And it's had detrimental effects on cities of Seattle and San Francisco, where people who work for the city, and I'm talking firefighters, policemen, teachers, cannot afford to live in the city where they work because the pricing has gone up. And the people who buy those houses generally work for corporations that pay a lot of money, and so they think they have a nice little playground, crime-free, and a lot of times color-free.
Behind me stands newly developed apartment homes and condos. It used to be the home for a local daycare in which many people in this community depended on for childcare. It like many other units, are examples of developments that were made, but not particularly for the community.
Affordable housing.
Well, I would just say this on rent control. I would not be for that. I think you're seeing in other states right now that implemented rent control. What happened is the private sector will pull out of those markets. So you may control the rent of the existing units that you have, but you're not going to get anybody to come in and invest and build anymore. And it's created a lot of problems. So I don't think that's a way to approach this.
Governor Brian Kemp voted against the expansion of Medicaid. Kemp's campaign has said Medicaid expansion would not have saved the hospital from closing. There are roughly 200,000 uninsured people living in Fulton and DeKalb counties alone. Full Medicaid expansion would have covered at least 75,000 more people in the two counties and funneled millions of dollars into supporting safety net hospitals, said Laura Colbert, executive director of the health policy organization Georgians for a Healthy Future. Atlanta Medical Center's Level 1 Trauma Center treated patients who suffered from severe injuries such as burns, blunt force trauma, and gunshot wounds. According to WGLC, nearly 50,000 patients were serviced over the past year, catering to more low-income individuals or people who did not have health insurance. Although WellStar has invested over $350 million into the hospital since 2016, they claim more than $100 million in losses. Inflation and decreasing revenue, quote, played a role in the decision to shutter the facility. With emergency rooms already overcrowded across the state of Georgia, Atlanta Medical Center's closure leaves only Grady Memorial Hospital as the only Level 1 trauma center in North Georgia. The only other Level 1 trauma centers in Georgia are in Augusta, Macon, and Savannah. With all the new developments in Fourth Ward and the addition of homes and condos in the $500,000 range, it leaves one to wonder how something so important as a hospital could afford to close in the same neighborhood that's being developed.
Fourth Ward would be the community most affected by Atlanta Medical Center's closing, along with other hospitals and the rest of Atlanta. Only 3 days after Atlanta Medical Center closed its emergency room, nearby hospitals report overcrowding. Piedmont Hospital advised they had to divert their ambulances elsewhere.
What effects do you think AMC's closing is going to have on the other hospitals in the city and their patients?
Well, I've got two takes on that. One is from a professional who says that they constantly gave you the worst service you could have. And as far as emergency rooms, I worked in that field as first responder. What you do, you ask people in the emergency, do you have a hospital preference? And you honor that. I never had one person tell me they wanted to go to Atlanta Medical Center for emergency. Now, a lot of times, emergency is a funny word because when you see these ambulances, a lot of times, and living in the city, the ones that I see transporting to Atlanta Medical when I'm that way, they're bringing people who may come from elderly care homes, and that's emergency. You know, their chest hurt, they're having seizures, they fall, but and they black out. Those are emergencies. But trauma emergencies, people generally don't go to Atlanta Medical. They go to Henry Grady Hospital. That's where you want to go, where they have professionals who see it all the time. They got great medical staff of people who come from Emory and Morehouse. And they've learned patient care. They know a lot of times emergencies, they happen to everybody. If it happens to poor people, homeless people, people who aren't used to medical care, the people at Great Hospital has seen it and they're trying to deal with it. But I haven't heard anybody say, you know, I was in a car accident, they couldn't find anywhere. When they took me to a hospital, it was so crowded they couldn't stitch me up, wasn't enough doctors, wasn't enough space. I think it's the image of it that they would close an emergency Trauma One hospital in an urban area because anything can happen. And that's where it may come into play. Mass shootings, a terrorist hit in Atlanta or the Atlanta area. I think that's when we'll feel it, because you need to have that in big cities, in urban areas. But the media says we're going to miss it. The political expert says it's going to have an impact. I'm just a citizen. I talk to people, and they say what I say. Good riddance, because they really didn't care. And it's operated by people called Wellstar. And I'm just talking in general from people I talk to. I'm just a citizen. We don't think Wellstar liked us, and we didn't like them.
Officials from Grady Health System released a statement about the closing and its potential effects on the already overcrowded conditions at Grady Memorial. Quote, Grady Health System is extremely disappointed in Wellstar's decision to close Atlanta Medical Center, which serves a predominantly minority and underserved community. In April, Wellstar made the decision to close the AMC South location with the caveat that they will remain committed to serving the community. Closing its second hospital in less than 6 months will have a devastating impact on patients, employees, and the Southeast region. Further, by not having a transition plan and referral mechanism for its patients, there will be harmful consequences on healthcare access for the people of Metro Atlanta and hospitals across the region. As a not-for-profit health system, Wellstar's mission was to enhance the health and well-being of every member of the community, but they have clearly prioritized profits over people, leaving 460 licensed hospital beds in the community empty and more than 120 patients per day having to seek emergency care elsewhere. Grady's commitment to serving our community with excellence will remain unchanged as we stand true in our mission to enhance the health and well-being of every patient we serve. Grady is exploring all legal options available to protect our patients, employees, and this entire region. Finish quote. This decision will have deep and reverberating consequences for the 500,000 residents of Atlanta and the hundreds of thousands of visitors and commuters to our city each day, Mayor Dickens wrote in a statement. The city of Atlanta received no advance notice of this decision and had no opportunity to engage with you to understand or help mitigate the factors leading to this closure. I require immediate information about your company's plans, what you're doing to mitigate the enormous health and economic impacts the closure will have on our community, plans for the multi-building campus once operation ceases, and how you will be supporting the impacted personnel. Dr. Melanie Thompson, an Atlanta internal medicine physician and HIV/AIDS researcher, say other area hospitals are already at capacity. Quote, the collapse of this hospital will shift the burden to all of the other hospitals. And if you or your mother has a stroke and that ambulance is turned away from Piedmont and Emory and Grady while the minutes tick away, where would you go? She said. These hospitals are full and overflowing, and this preventable closure will stress them to the tipping point. Atlanta Mayor Andre Dickens wants to make sure Wellstar AMC is not redeveloped immediately when it closes. He signed an executive order banning any repurposing of the 25-acre Northeast Atlanta site. The mayor says he wants the city to have time to review the impact of the hospital's closure. Dickens said he had, quote, extreme concerns about the hospital's closure after Wellstar made the announcement without consulting his office. The executive order requires the Department of City Planning to deny any applications for rezoning, building permits, land disturbances, lot consolidation, and more. We briefly interviewed a 30-year-old one-year resident of Fourth Ward. He gave his opinions about the hospital closing. So are you a resident of the Fourth Ward community, sir?
Yeah, I am.
And how long have you been here?
A little over a year.
And are you aware of Atlanta Medical Center, the local hospital, closing on November 1st?
Yeah, I am.
What are your thoughts on that?
I'm not happy about it. I actually went to the gym there at the Highland Athletic Club, and so it was a real community center for people, and it's closing. And I mean, even bigger than that is, the hospital infrastructure in town, the way it's going to put pressure on Grady and so many people losing their jobs. I mean, the list goes on and on and on of reasons why it's a bad idea.
We ran into a 65-year-old resident of the Fourth Ward community who had lived there for over 30 years. She also gave us her opinion about the hospital closing. Good afternoon, ma'am. Are you a resident of the Fourth Ward community?
I've been here 30 years.
30 years. And are you aware that the local hospital, Atlanta Medical Center, will be closing November 1st?
Yes, I am.
And what are your thoughts on that?
I'm disgusted by it because we could walk to the doctor. We could come up there for emergencies. We could do anything we could do over there, and now we can't go there. And it don't make no sense.
What is your plan after November 1st for medical care?
Well, I go to Emory University now. I got a lung cancer and I had a brain tumor. So I don't even hardly go there no more.
We got to talk to two young healthcare professionals on the Beltline about the hospital closing. Here are their thoughts. Good afternoon. What neighborhood are you a resident in?
Tucker.
And what are your thoughts of the Atlanta Medical Center closing?
I think it's catastrophic for the Atlanta communities. I think it's going to put an incomprehensible strain on Grady's emergency room and resources, and it's a awful decision.
And I had a friend who, before it was even closed, Ames was closing, she works as an EMT, and she said that for so chest pain, I don't know how familiar you are with that, but it should get you into a room immediately if you have chest pain. Yeah. So if you have chest pain, that could be a heart attack, they're putting you in a room immediately. There was a 2-hour wait for chest pain in the Grady ER prior to AMC closing.
So yeah.
But my friends who are working in the ER right now, and they're just beat. They don't even get lunches sometimes because there's so much stuff going on. And I think Grady's gonna have to rapidly. What I heard is that they're expanding, but it's part of it might. I don't want to do hearsay, but I heard some of it might end up having to be temporarily outside. They're doing tents
I don't know.
or something. I don't know.
A 36-year-old who was born at Georgia Baptist interviewed his mom about her experience with the hospital.
How long were you a patient at Georgia Baptist?
4 to 5 days. I gave birth in 1986, and how I ended up at Georgia Baptist, giving birth at Georgia Baptist, is my doctor was residency at Georgia Baptist in Crawford Long. The night that I went into labor, I went to Crawford Long and was advised that my doctor was at Georgia Baptist. And since my contractions were far enough apart, I was able to drive to Georgia Baptist and have my doctor give birth there.
So you were not necessarily living in the community?
Right.
Okay. What was your experience at Georgia Baptist during your tenure as a patient?
I thought the service was great, the nurses were great. Obviously, my doctor was great because I left Crawford Long to go to Georgia Baptist. And one of the things that I remember about my delivery is that they served the new parents a steak dinner, and I don't think they do that nowadays. And that just was something that stayed in my head.
What impact did Georgia Baptist have on the Atlanta community during those years?
I think back in 1986 when I gave birth, it had a big impact because there were multiple hospitals, and it made the nurses and the doctors kind of give better service, so to speak. So because you had choices versus now, some places you don't get great services because you don't have multiple hospitals to go to.
How disappointing is it to know that the history of this facility is coming to an end due to financial reasons?
It's very disappointing. I mean, based off of my previous answer as to having multiple hospitals to go to, such as Crawford Long, Georgia Baptist, Grady Hospital. I mean, it made it where you knew your services, or you hope your services would be great because there were competition. And based on this day and time, since we're losing a lot of hospitals and we are losing a lot of beds, it's very disappointing. And so it's heartbreaking to hear.
Today I got to sit down with a 71-year-old former resident of Fourth Ward who now resides in Mechanicsville. She shares some insight with us about her feelings about the hospital closing and her experiences as a patient there. How long have you been a patient of Atlanta Medical Center?
I have been a patient of Atlanta Medical Center for approximately 30 years.
What impact did the hospital serve to the community?
With Atlanta Medical Center being at the heart of downtown Atlanta, the most impact that it served the community was in the Fourth Ward. The Fourth Ward is in the center of a multifaceted melting pot community, and the Fourth Ward mainly are subject to no insurance, Section 8 and financial difficulties, and the hospital was always there, accessible to anyone's needs at that time.
Were you insured during your tenure as a patient of Atlanta Medical Center? If not, what was that experience like?
From the beginning of my relocation into Atlanta, I did not have adequate medical care, and I did not have what you would say primary care. So at any time that I had to enter the hospital under emergency care, there were no problems with the staff working out the financial arrangements and giving you the treatment that you needed.
Fourth Ward is the closest neighborhood that will feel the effects of Atlanta Medical Center closing. But as far as you know, what other communities will be affected?
Fourth Ward is the primary area that will be most affected, but the boundary lines throughout the city and the emergency care that comes unexpected to anyone at any time, from the least to the greatest. We have athletic people here, we have tourists here, we have government downtown, and at any given time, we will not have a second level 1 trauma center for any type of care at all. And with the burden being placed on the other hospitals, it's going to be really chaos.
How will you attend to your medical needs once the hospital closes its doors?
Well, the update at this present time is that the presiding hospitals in the area are opening their doors to take on the load. Well, as far as my personal care is concerned, one of the hospitals that is welcoming patients, I'm already a patient at this facility.
Do you personally know any of your peers that will also be displaced patients as a result of this?
At this present time, I can't say specifically anyone that I know that will be displaced, but I do still have family and friends in the Fourth Ward who will be heavily affected because they have children. Most of the seniors there are right there at the hospital on both corners, and they have nowhere to go.
Are you disappointed that money is the main factor Wellstar decided to close its doors? Or is there a part inside of you that understands that that's just how business works?
Well, for the people that are in high places, I don't think the money should be the issue, because under any other circumstances, you can raise this kind of money and keep this hospital and this agency and this well-facilitated medical facility running. So I can't really agree with that's how business goes, because all of us need a hospital at any moment. Bullets are flying. The highway is getting ready to be gridlocked until next June. Where are the trauma patients going to go? When you get to Grady, they're going to turn you around, or maybe they have now at least expanded the units and the beds. But we're yet to see the worst housing and the worst medical chaos here at the end of the year that is just going to be unbelievable.
Mayor Dickens says that the closing of the hospital comes as a shocking surprise to his office. Do you feel the city/state government could have done more to be proactive about this situation?
Well, I would say as far as Mayor Dickens is concerned and the city politics, Atlanta Medical Center is a private agency. So I can't give my opinion one way or the other if they had any type of communications, but it did come as a surprise to the whole city. And if it came as a surprise to the office, to the mayor's office, then at this point, something should have been done to at least allot some of the monies, the $100 million or what have you, that were allotted to Grady, Emory, the residing hospitals. What I'm saying is, we never heard them say, hey, we'll give Atlanta, they said they went in the hole at $8 million during the COVID. So you would think for the city of Atlanta, which is just growing out of control, that you would try to preserve this place. The hospital said that the city did not offer them any type of help, none whatsoever. And at that point, since they are private, they gave the deuces.
If you had to rank this crisis 1 out of 10 according to your personal well-being, how would you rank it?
In this ranking from 1 to 10, I can expressly state that I give it a 10 of deep concern because I am a certified professional medical assistant. And at this time, we need to be healthy. We need to take care of ourselves more. We need to stop some of the things that are bringing our health down because we do not have health care. We do not have anyone in the health care to care until you come up with some insurance and some money.
The mayor's office has made a temporary block on any developers or private entities to acquire the property that Atlanta Medical Center sits on. What do you think will ultimately happen to that property? Do you think it will remain a hospital, or do you eventually think it's going to be bought out by somebody?
I truly believe and I truly hope that the gentrification on Boulevard does not rob us of at least 2 level 1 hospital in the Midtown area. If at some point we come to the rude awakening that this property has been bought and is going to be used to create more unaffordable living, which is going to be a greater burden on the Fourth Ward, then we can then say, yes, it's got something to do with the money.
Thank you so much for taking the time to interview with me and to answer these questions honestly. I wish the best of luck to you.
Thank you so much, Daniel.
We really appreciate you tuning in to our first journalistic style episode. We really looked forward to bringing you a different style and format of the podcast. And like I said, the last episode, moving forward, these are the kind of topics and pieces we'll be covering. We learned a whole lot doing a dig deep on the hospital, gentrification, going around getting the footage. And yeah, it's just really unfortunate the hospital that once served a community is no longer there anymore.
Yeah, it's been very eye-opening, to say the least. Everything that we've found out about the history of the hospital. I guess it should have been a little bit more common sense about the patients of the hospital, since it wasn't desegregated until 1965. So that was pretty surprising, discovering that. But just also seeing the gentrification, the new development up close was very shocking.
Yeah, growing up in Fourth Ward, of course, I have not lived there since 2007. So, 15, when I was 20, I moved away out of my mom's house, rightfully so. And then she moved to where she is now, which is over in the West End. So I only just pass by it, or I might pull up on some folks at the park here and there. But for the most part, since the development has happened, I haven't actually gotten out of my car and walked around Boulevard, Angier, Parkway, all the little spots that we hit on the episode. So to do that with you and to really it's one thing when you just drive by it and you be like, damn, that's crazy that that's there, or what's this new thing, or what's this construction. But when you kind of just get out your car and walk outside and walk around it and walk amongst the residents that are the original residents compared to the new residents, and you really can just breathe. It's hard to explain.
It's embarrassing.
Yeah, it's embarrassing.
It's embarrassing. That's how I felt.
You walk right up on it and you're like, what are these brownstones? These used to be like project homes on Felton, or this used to be it was all projects basically. Yeah. So it was eye-opening for me, and I'm well aware of it, and I know what old Fourth Ward used to look like, and even for me, I'm like, oh my God, like,
how did this happen?
How did this happen?
How did we get to this point where where it used to be affordable? Number one, it used to be affordable, but number two, just regular looking apartment homes, or even project style apartment homes, to $500,000 homes. I mean, not that much time has passed by for to have those two extremes. So
no, you're totally right. And so much in a blip that even the people, off camera, we talked to some of the residents there, and they're just like, yeah, like, we see it happen every day. We're still here. We're still doing our business around here. You know what I'm saying? And it's a total contradiction of like what the reality of the neighborhood is compared to what they want it to be. And I just wonder how soon the want it to be is going to go into effect, because right now you're just getting the developments going down, but it was a whole cookout. It's a whole OG Fourth Ward cookout going on that Sunday. We were out there, and it had all the all-star, all the neighborhood all-stars, like it always was.
Some things it's like some things won't ever change down there, but eventually all things will have to come to a head, especially if what they decide to do with this hospital is replace it with the inevitable. Like, that's, eventually all things come to an end.
Right.
So it's just, it's kind of disappointing.
It is disappointing. And you bring up the hospital, which all of these things kind of, whether gentrification was a contributing factor, or the development, even if the development of Fourth Ward and the hospital closing are two separate entities, it's interesting how one thing could be happening on one block and then this other thing happening just one block over. The closing of a whole hospital, all while the complete development of the development and gentrification of a hood where it once was $40 a month rent and now it's units starting in the high 400,000s. Starting, not that's the going rate. That's like if you want the one bedroom small, if you want the smallest,
the studio.
Yeah, studio.
Yeah, you'll pay 400, the high 400s.
So you're paying $500,000 to live in a neighborhood in which the hospital can't afford to stay open. So that kind of, one thing we didn't cover too much in this episode was like the government, the local, the city government's plan or lack thereof. And, this has just all happened under everybody's nose. None of these mayors of present or the past can pretend like they didn't know gentrification was on the radar, is happening, where it was going, who was being affected by it. Yeah, and at the end of the day, it looks good for them. Bringing developments, revitalizing neighborhoods, all that looks good to them. And then it's just real easy for them to make a statement as like, well, we're going to try to do something about affordable housing, or we have a plan in place that probably won't happen, but if I say it'll happen, that at least makes me look good. But
it's the same with the hold Andre Dickens has put on the hospital now. It looks good and it sounds good for him to say they'll decline any applications for it to be redeveloped and made into condos. But what's going to happen in the next month or the next couple of months when ultimately you can't hold on to that land without selling it to the best, to the highest bidder. And so it's just kind of
too little, too late.
It's too little, too late. We reached out to the mayor's office to ask him some questions about the hospital and about gentrification. We haven't gotten an answer back yet. We hope to hear from him and to, discuss this a little bit further, try and figure out what the plan is for these displaced residents and displaced patients.
Yeah, and talking about the displacement of patients, I've actually got a list of where Wellstar is relocating. They basically, if you go on Wellstar's current website, it basically says patients at affected clinics will receive a letter from Wellstar about where their physician is moving or how they can find a new clinician at Wellstar or another healthcare provider according to their needs and locations. And just an example, they are moving their offices to places like Austell, places like Marietta, places like Smyrna.
Not in the city.
Yeah, right. So basically, all of the medical care and kind of like what you would call like specific, like very specific medical services that the community depended on, they're all just kind of getting scattered to different parts of town, which I guess they deem a better part of town for them financially. And even the financial thing at the end of the day, like it is all business, but you tend to don't think of things like a hospital as business being the priority for it. And it's just going to affect all these different hospitals. Emory,
Piedmont, Grady.
And Grady being the main one. And,
Emory.
Grady was already on the ropes in the early 2000s during the first recession, the health. Basically, it was a healthcare crisis as well as the housing crisis. But Grady basically got bailed out then, which it should have. And Grady was basically talking about closing its doors then. So how does this help? How does this help a situation that's already a bad one in terms of packed emergency rooms, already patients who may or may not have insurance, all of this is just going to get shifted, and the burden's going to be placed to these different hospitals. And Wellstar is just like, hey, like we can't keep losing money. So instead, for an indefinite period of time, we're just going to have an abandoned hospital in basically what is downtown Atlanta, just east of downtown Atlanta, in a neighborhood that is completely being redeveloped with $500,000 and up dollar properties. If this was happening on my watch, I would be embarrassed. And I'll give Mayor Dickens a little bit of credit. He just became mayor. So these problems were happening under Kasim Reed's watch, Keisha Lance Bottom's watch. And these are the names when I say, like, if you go back and interview them, they can't play pretend about gentrification.
They were purporting.
Right. It basically looks good, and it wasn't no shame in Kasim's game.
Oh no,
he's the reason why we have Mercedes-Benz Stadium. And Vine City is the same. I don't see much good that's done for that community, other than if you were fortunate enough to own a property there.
You made money.
You probably make some money now, but you probably got lowballed and sold it 6 years ago or 5 years or however many years ago, and not during this peak. Someone else is taking advantage of that peak. And that's a whole nother problem to talk about in terms of people not knowing
how to
hold on to property, knowing when to strike when the iron's hot. That's a whole nother conversation. So yeah, it was interesting to go this route. We learned a lot. We probably will do like a part 2 as this develops. We really want to cover topics that aren't so current that they'll be irrelevant. We kind of want to cover ongoing topics, and right now the hospital closing and gentrification are here for a minute. They're not going to figure out the hospital thing. Unfortunately, there's not. We could wait for a statement. It'll be a generic one. There's really not much. The damage is done. The hospital's made its decision. You're not going to be able to just be like, okay, well, we'll open back up January. We'll be back open for business February.
Ultimately, the decision is Wellstar's, and if they're selling, then
right,
that's it.
It's only so long you can hold on to a plot of land, which is like a $1 billion gold mine for somebody who wants it and wants to develop it into whatever. Now that whatever is probably going to be condos. That would be a crying shame if what used to once be a pivotal service to the community and a service in which should never be discontinued because no one had the foresight to realize, hey, maybe we need to sign a bill. Maybe we need to figure out how to keep the doors of this hospital open. It's like, okay, well, hospital losing money, that's their problem. That's not the city's problem. Well, eventually, a company that's losing money will just stop doing business where it's at. And that's what's kind of sad to me is the city of Atlanta be worried about so many things except for the actual problems that it needs to address. We try to do so much. What do you say? You got too much dip on your chip? The city of Atlanta certainly has too much dip on its chip right now. And, that's just for lack of better words. Yeah. So, anything else you want to say, Joe?
No, I think that's about all. Again, it's just very eye-opening, to say the least, about everything that we've covered in this episode, from the hospital's origins, so what Fourth Ward is and becoming. No.
Again, thank you so much for tuning in. We definitely are still open to like doing some different, like we'll still do interviews. It'll
On
just be a
topic.
different kind of topic. I know y'all probably see us sitting here with these shirts and ties on, like, who do we think we are? But
Journalists.
yeah, we trying to really like I said this from the beginning. We want this podcast to grow into something more than what you were just used to seeing. And we did a run of interviews. That was fun. We learned how to put an episode, an hour of things together. But now we want to take it to the next level. And
We want to do a show that's different from everything else that you've seen.
Right.
Not just what we've done in the past, but we want to do something new, clean, and original. And this is the direction we've been looking to go into for a long time. So this is it. And
Right.
we hope you appreciate it.
yeah, we definitely do. Looking to expand our audience, looking to expand our other people's interest level and wanting to come on the show. And yeah, just keep tuning in. We gonna keep making this content. Episodes like this aren't as easy as just sitting down with someone and talking for a few hours and chopping it up. So we'll be back trying to work on a consistency level. But if you have any topics that you want us to cover, feel free to leave it in the comments. If you like this episode, share it with a friend. If you haven't subscribed yet, subscribe. We still trying to get them YouTube subscribe numbers up. And other than that, we appreciate you. Thank you so much.
Thank you.